Myself, Dr. Shubhaprakash Sanyal, Director of Hematology and Bone Marrow Transplant Services of Fortis Group of Hospitals, Mumbai. So today I shall be talking about what is the role of bone marrow transplant in blood cancer patients. So when we talk about the bone marrow transplant in today's world, we divide into two main groups. One is called autologous bone marrow transplant and other is the allogeneic bone marrow transplant. Autologous bone marrow transplant means when the donor is patient himself, and allogeneic bone marrow transplant means when the donor is not the patient, he is a normal individual. It can be brother sister, fully HLA matched, what we call full sibling match. When we can get the half match, that is a partially matched around 5 by 10 HLA or 6 by 10 HLA, we call it as a haploidentical bone marrow transplant. And sometimes we can get full match from the different registries of the stem cell, what we call matched unrelated donor sibling transplant. So when we talk about the autologous bone marrow transplant, the most of the time the indications are multiple myeloma and the lymphomas. In multiple myeloma, the standard way of treating the patient is give some induction chemotherapy. That means you control the disease. If the patient is physically fit, then you do the autologous bone marrow transplant, which actually helps to increases the progressive free survival. That means disease free life, as well as it increases the reflects the overall survival too. Autologous stem cell transplant in the lymphoma world is little different. It is a curative treatment, and around 50 to 60% patient, when they got a relapse of their disease, they get some salvage chemotherapy and then they undergone the autologous bone marrow transplantation, and 60 to 60% patients almost are completely cured. They don't require any sort of therapy thereafter after finishing the successful autologous bone marrow transplantation. Allogenic bone marrow transplant is a very different philosophy. Here we basically utilize the effect which is called graft versus leukemia effect, and that is basically we do in different type of conditions like acute myeloid leukemia, acute lymphocytic leukemia, like that. But most important factor here, it depends on the who is the donor. We basically do a simple test which is called HLA typing, which is basically to understand the immune matching between the donor and recipient, and the own brother and sisters are always the best match, what is called sibling donor. So sibling bone marrow transplantation, the any sort of AML and ALL cure rate is almost again 50 to 60%. In half match transplantation, what we call haploidentical transplantation also, our cure rates are almost touching like a sibling like sort of thing, and but complications rates are also easily manageable in the down the line. So in one short line, the bone marrow transplantation is definitely curative treatment. Most of the hematological malignancies like AML, ALL, lymphoma, and to some extent multiple myeloma too. Thank you.